Start the recording. Right. Right. Power of the mother, that the mother decide whether to give or withhold survival of the child itself. Right. Now, when you come to the definition, what is meant by infanticide is that it's a killing of an infant. Infant is a child whose age is less than 1 year by its biological mother when balance of the mind of the mother is disturbed due to the effect of pregnancy, childbirth, and lactation. So there are certain criteria that we have to fulfill before you classify it as an infanticide. First of all, it has to be a child or infant whose age is less than 1 year of age. Then the person who killed the child should be its biological mother, and it is done by the biological mother when the balance of her mind is affected due to the effects of pregnancy, childbirth, and lactation, all three. So, all these three conditions should be fulfilled before you classify a killing of an infant as infanticide. So, you know that well, it comes under, as I remember, it's exception 5 of 294, the penal code, right? So if it is in case that it is not the biological mother, it's not classified as an infanticide. If
Sir,
yes,
sir, so
yeah,
how do you prove the mother is disturbed due to the pregnancy?
yeah. So that is fine. I'll tell you why during the examination part, right? Because
Oh,
now here that this is just defined. Say infant killed by the biological mother when the mind of the mother is disturbed due to the effects of pregnancy, childbirth, lactation. So this is just I'm just going through what is meant by the definition, and all these three should be fulfilled, right? Now there are certain risk factors. Uh, if I forget to describe how to check my psychological status, just remind me, right? Because I think it's coming up in another slide. So I'll just skip it and continue. So there are risk factors. Like usually the if one baby is killed, then the second or the subsequent child is more prone to get killed, right? Due to various factors. And also teen pregnancies or teen mothers, or particularly the maternal age is less than 15 years, the studies have showed that the infanticide is more. And also it depends on the maternal education level at the time of birth as well. So these are sociological factors which are suggested by the certain researchers. Now, in proving, now it's the onus of proving the case on the prosecution. No? So the prosecution has to prove that it was a live birth, right? Because you know that there will be cases of stillbirth where the baby was already dead, right? Just before or while uh, during the childbirth, right? And there may be cases where the fetus or baby is dead for a long time within the womb, where it's called as intrauterine death, right? So if that is the case, then we cannot classify or consider it as an infanticide. So it has to be a live birth. Then the second one, as I told you, the age of the baby should be less than 12 months of age, right? Because we are talking about infanticide. So infant is a baby who is less than 12 months of age. So this 12 months is arbitrary. We have classified this one as because we consider or we define an infant as a baby is less than 12 months of age, and also the studies have proved the effects of pregnancy, lactation, delivery, and lactation affecting the mother psychologically could go up to even 1 year, right? So we have this arbitrary limit of 1 year for two reasons. Then The next one is that we have to prove the mother is mentally not normal. Right? It's the whatever the pregnancy, childbirth, or lactation has affected the mother psychologically, so she is not psychologically normal. Then the next point is the prosecution has to prove that death is not natural. So if it is a natural death where the baby dies of say some in abnormality, congenital abnormality, if, for example, affecting the heart, which is not compatible with the life, or a serious um, abnormality where the baby dies spontaneously, then you cannot classify it as uh, 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 infanticide because the death is natural. Then death should not be due to an accident, right? Like say accidentally baby falling down and receiving head injury and dying, it's not infanticide. It's a death of an infant, but not an infanticide. Then the other important thing is there should be some act of commission, something like the mother has done to kill the baby, like strangulation, blows, blunt force trauma, maybe stabbing, cutting, whatever, poisoning. There are certain things mother does to kill the baby, right? So there should be either act of commission or an act of omission, like failure to do certain things, like failure to tie the cord, failure to dress the child, failure to feed, right? So there's actually those are also, I would think, even can consider as acts of commission, but where the mother is withholding certain things which is usually given to the baby. Right. So then, therefore, when we investigate a case of infanticide, we have to do detailed autopsy, right? Rather, we'll take the history, and if possible, uh, even scene visit, depending on the case, right? So, do a detailed autopsy. Then medical legally we determine whether the child is viable or not viable, in the sense now, when the baby is in the womb, you start from the time of conception to the delivery, baby, the embryo grows, right? And there's a certain time in the period where if the baby is born prior to that, baby doesn't have the ability to survive individually. So in Sri Lanka, usually we consider now the period of pregnancy is usually considered to be 40 weeks. So 28-week baby was grown in the womb for 28 weeks or more. We consider the baby to be viable. He has the ability to survive alone. Uh, Now, it doesn't mean that the baby is born before 28 weeks will they all will die. No, some will survive, but we have said that the arbitrary limit as 28 weeks because depending on the baby's development, baby, depending on the facilities available, it's somewhat unlikely, or and babies are more prone to die if they are born before 28 weeks. So this arbitrary limit of, sorry, 28 weeks is set as the age of viability. Then next thing that we have to determine whether the baby has been born alive or born dead. Uh, then if the baby is born alive, the next thing is we try to assess the time of survival. It may be few hours, which will be very difficult to determine even medically, maybe few days, few weeks, few months, right? Then the cause of death and the circumstance of death, right? So we have, when you are doing autopsy with regard to infanticide, we have to mainly, we have to uh, assess all these five things. Otherwise, it will be difficult either to prove or uh, confirm or exclude the possibility of infanticide. Now, medical legal aspects of infanticide, as I told you, uh, that the viability of the baby is an important thing to be determined. Now, it is important to establish the viability, which determines whether it is capable of separate existence. Now, I know that the term separate existence uh, come in other countries in other laws, but we usually to classify the infanticide, we don't consider it as a separate existence because according to our law, right, even the baby shows signs of life while during the delivery or soon after delivery, we consider it to be a live birth. Like now, when the baby is delivered, if it makes a noise or it moves its hands or feet, even for a short while, we consider it to be a live birth, apparently, right? So the separate existence, I think in England, of course, we had proved that the baby had a separate, even after fully born, that it showed life, signs of life. But here, even during the delivery, it shows signs of life. We consider it to be a live birth. Now, uh, now, the point here is if we say, if the doctor says this baby is not viable, then it's practically exclude a possibility infanticide. But you have to be aware that now this we are talking about arbitrary limits. Like I said, 28 weeks. So say I do a autopsy and I determine the baby's uh, age to be 24 weeks and baby is found dead, say that this baby is not viable, right? But on top of that, in certain instances, you might find injuries inflicted on the baby, right? Intentional injuries. So in that setup, that it will become a little bit a complicated matter. But only thing is now when you, so as I know, correct me if I'm wrong, when it is like a murder, you have to prove the prosecution has to prove the case beyond any reasonable doubt. But when it comes to infanticide, you have to prove it beyond any possible doubt. Not even a small slightest doubt, we tend to exclude infanticide because the reason is you are dealing with the mother and baby. And also by the definition, we say that mother is mentally not normal, right? So we are not, I mean, so it's, as I told you, it's not like another murderer or serious killer in the loose. It's mother and baby. And if next time it will affect the next baby the most, right? So we tend to make sure that it all these things fits in identically to the definition we are talking about. So the slightest doubt we tend to exclude it. But in case that say baby is just below 28 weeks, say 27 weeks, and you see cut injury in the neck, then the case would be different, that we have to go be probably beyond limits and decide whether actually the baby has was viable or not, or whether there has been baby has born live or not. Because as I told you earlier, babies even before 28 weeks, maybe even 24, 23 weeks, are capable of being born alive and surviving, right? So when the viability is less than 28 weeks, without any injuries, baby death, we tend to classify this as an abortion or spontaneous death, not infant death. But baby is born before 28 weeks with suspicious injuries, then you have to be more careful. You have to be detailed autopsy and decide whether this injuries actually contributed to death or whether baby is actually born alive, because still you can find signs of live birth, which I will describe later, right? So it becomes a little bit a difficult case, but determine the viability is an important fact here. Now how to establish the viability? We have to determine how old the baby is. I mean, the growth period. I told you that usually the intrauterine in the womb, it grows for 40 weeks, and 28 weeks the limit, the viability age we are concerned about. Right? So we have to use certain medical methods to decide whether the baby is less than 28 weeks or more than 28 weeks. So one thing is by considering, sorry, by considering the fetal development. And another, this is, I would say, the Bithwood method called Hazard's formula, where we have a rough guide. I will tell you what it is. Use it to assess the viability of the child. Now, regarding the fetal development, one parameter we are checking is the length, crown heel length from the top of the head to the heel when the baby is kept stretched, right? Usually we use a osteometric board where I think I have a photograph or slide that which shows that board. Keep on that and measure from the top of the head to the heel. So if it is 50 to 53 centimeters, that means that the baby is fully grown, term baby. So roughly the baby had been there within the mother's womb for near close to 40 weeks, right? So you have a charts which has been prepared because a different length according to the intrauterine growth period. So we compare with the chart and determine what the fetal age is. Then the biparietal diameter, where you get the circumference of the head just above the level of the ears, you get the circumference, and also the crown rump length. That means the top of the head to the buttocks, right? So all these crown heel, biparietal diameter, and crown rump length, we have the charts. I'm not sure that you have any charts prepared for the Sri Lankan children, but even the international ones are almost similar, so you can use them. So what we do is we measure this length, compare with the chart, and see what the corresponding intrauterine growth period. Then the next one is the weight. Now, if the baby is like some around 2.5 kilos or above, we consider them to be term. Again, we use the charts, the already prepared chart graphs to see we get the say 1 point, the baby's weight is 1.6. So we'll check from the chart where it tallies 1.6, how many weeks. So according you all these four parameters, the three lengths, crown heel, biparietal diameter, crown rump, and weight, we use the already prepared charts to compare and get an idea about the growth period or the age within the womb. Then the external appearance, eyes, fully grown term baby, usually eyebrows, eyelashes are very well developed, eyelids, and we have a short pupillary membrane. Then the hand and feet, all the skin, most of the skin creases are well developed, and also the fingernails and toenails, um, they are normally present. That indicates the baby to be the mature. Then the umbilical cord, right? It's fully developed. Umbilical cord again indicates the baby to be towards the mature, right? So again, you compare with the different appearances of umbilical cord with different fetal age, and the if available, the placenta. Placenta is the part that connects the baby to the mother's womb, right? So if you examine the placenta, sometimes we are able to do it, sometimes it is not present, right? If it is a fully developed placenta by the weight, appearance, then again you consider the baby to be towards a term or about 28 weeks or not. Then in a case of male, the external genitalia, the testis usually descended into the scrotum, which indicates growth of 9 months within the womb. Then few other signs and symptoms. Vernix caseosa is a very whitish substance that is present or seen on the skin. So if it is abundant, that puts the case towards immature child, right? And the presence of meconium. Meconium is the stools develop form in the gut of the baby. So if it's like a greenish color, green, brown, greenish, blackish color. If you see meconium in the bowels, that indicates the baby to be on the mature side. Then the lanugohea is a thin, uh, very thin hair covering the body, right? So if there are a lot of hair, this type of fine brownish to black hair covering the body, that puts the case towards immaturity, right? So as the baby mature, this hair falls out. And also, so these, there are multiple, what I want to stress is there are multiple signs and symptoms and criteria we looked or assessed when we are determining the viability. Some, as I told you, measurements, you compare with the charts. Then the eyes, hand, these are, it's easy to, somewhat easy to assess. Sometimes umbilical cord, placental weight, it be some, maybe sometimes it might be available, it might not be available, right? So you don't have to worry that if it is not available, right? So what we do is when we have multiple criterias, we take the probability, like say all 10 now, 7 out of 10 criteria indicates baby to be mature about 28 weeks. When we say, they say the baby is viable. If it is the other way, we tend to say baby is not viable, right? So now out of these signs, the ossification centers, presence of ossification centers and the viability assessment by ossification centers is supposed to be more accurate. um, so I will tell you what is meant by classification centers. Uh, but first, let me tell you something about the something which I have told you earlier. Now, I think the first two criteria I told you, this is called, there's a formula called Hassel's formula, which is a very crude method, right? But you can get some idea at the start of the autopsy or start of the investigation. Now it is just calculated by using the crown heel length, right? Now what you do is the crown heel length is known. Intrauterine age can be calculated by these following equation, right? Up to 25 centimeters. Say if the length, crown heel length is up to 25 centimeters, you take the square root of the value. For example, the crown heel length is 9 centimeters. To get the square root of 9 is 3. So we say intrauterine age or the age within the womb is 3 months. If it is 16, it is 4. Now don't worry about what happened between, if it is 10 or 11, right? So if 9 is 3, 16 is 4, anything, any length between the two has to be between third and fourth month, right? So it's not very accurate. So don't worry about the accuracy. This is just a guide. So if you see a baby about 60 centimeters long, you, from the look of it, you know that it is very premature and not viable. Together with, but you don't stop, you look for other uh, signs as well. If the length is about 25 centimeters, then usually what you do, you divide it by 5. For example, if it is 30 centimeters, divide by 5 is equal to 6 months intrauterine age. So just remember it. We don't use it much, but because it's not a accurate assessment, but this is just to guide you or give you an idea as you see in the, as you see the baby, right? uh, Now correct way to measure the crown heel length, as I told you earlier, to use a thing called osteometric board. Right now, the so-called osteometric board manufactured ones are very expensive, but it is a very simple device where you can even make one at home. Right now, this is the thing called osteometric board where we use to measure the uh, length of a bone. Because if you use the tape, either steel or cloth tape, you can't get uh, correct uh, length or the correct measurement. So in this osteometric board, this is a flat board, and there's a resting fixed plate here, which you cannot move, it is fixed, and this part is movable. So what you do is you keep the baby here, head resting, head face looking up, top of the head resting on this fixed part. Then you stretch the baby. The soles also kept perpendicular to the board and move this and keep post the soles, and you take the this length. There'll be a scale on this, so you read it, right? So that is how you get the pound heel length in most instances. So therefore, now I will go one by one. I will come to the ossification centers later, right? So just to go through these, the things that we usually measure to assess the fetal development, Hassel's formula, the length, three lengths, crown heel length, biparietal diameter, crown round, then the weight, then the appearance of eyes, hand, and feet, umbilical cord, placental weight, and the placental development, external genitalia. This is presence of pharynx cursiosa, presence of meconium, and called lanugoria, and lastly, ossification centers. Right. So I already told you about Hassel's formula. Now, how would we say the time since birth, or the from using the umbilical stump? Now, the umbilical cord is cut and tied, you can examine the umbilical stump as well, right? So naturally what happened, uh, this is slowly shrink, dried up, and the blood vessels in the lumen, right? Because there are three vessels, uh, two veins and artery, which connects the mother's circulation to babies, right? So these things dries up. So vessels will shrink, totally umbilical cord diaphysis also shrink, and then becoming fibrous, and it falls out. Now, so therefore, when if you see the baby, a dead baby, with the umbilical stump, examining the umbilical stump is another way of assessing the survival period of the baby, right? So if you see a like a fresh thing that you mean that the baby has died, maybe soon after death, right? So if the ends shows cut end shows drying up, usual only the usual survival period is less than 24 weeks, 24 hours, right? Then what happens is if the baby lives beyond that, the base of the umbilical stump where it connects to the abdomen or the stomach will show some signs of inflammation, because there will be inflammation reaction going, because the umbilical cord is starting to drying up, so the skin baby reacts, and you can see a nice reddish inflammatory reaction around the umbilical base, which says that baby has survived about 2 days, right? So sometimes, now even if other signs and symptoms suggest you that it is a possibly maybe a premature or even a non-viable baby, if you see a dead baby with the inflammatory reaction at the base, That means the baby has lived up to around 2 days. The cause of death may be natural or unnatural. That's a different thing. But so if you see it, then it put you're almost sure that the baby is born alive, not dead. So even a baby of less than 28 weeks showing this sign indicates it has been a live birth, not an abortion or dead stillbirth. Right? So it is important. So all cases when we get if the umbilical stump is present, we uh, have to examine that. Then the obliteration and like mummification, drying up changes in the artery is seen. That means the baby has lived up to about 3 days. Then the veins get obliterated later. If you see now at 3 days, you see the artery being constricted, but the veins patent. But if you see both artery and both veins also drying up and obliterating, it puts the survival period or age about 5 days. And around 6 days, umbilical stump falls off. Right? So if you see a baby, dead baby with the umbilical stump fallen off and the base is still fresh, that puts the age around 6 days. And if you see completely healed base, it is around 10 days. So right. So if you the important thing that you have to gather is if you see a dead baby, even the the assessment of the age is less than 28 weeks. But if you see completely healed umbilical stump, that means that baby has been lived he has lived up to 10 days. So therefore, you are sure that it was a live birth, not a stillbirth or a dead born baby, right? So viability or the age may be less than 28 weeks, but this assures you that it's very likely to be a live birth. Then sometimes, if available, you can check the blood as well of the baby, right? Now, when the baby is in the womb, it doesn't go through this normal process of breathing. It gets its nutrition and oxygen from the mother's blood. Right? Therefore, now we all of us have this thing called hemoglobin, right, which carries the oxygen in the blood to the tissues or even in the lungs. That is where oxygen is transferred. Right? So, but now the baby is within the womb living in a oxygen compromised uh, environment, right? It doesn't get any external oxygen into the lung. It gets from the mother. So therefore, the hemoglobin type available in the baby or seen in the baby is different from adult hemoglobin type. So which is called fetal hemoglobin or HbF. And even the red blood cells, usually all living cells, we have a thing called nucleus. But usually the red blood cell in an adult, it doesn't have a nucleus because that space is also utilized to contain some more hemoglobin so that it can carry more oxygen. But in fetus, they usually have the red blood cells with the nucleus, right? So the presence of nucleated red blood cells indicates baby to be mature, but toward the time of uh, birth or maybe few hours or few days within birth, right? So what happened to the HbF? I told you HbF around birth, 80% of about around 80% of hemoglobin is of HbF type, fetal type. About 20% they have the adult type, right? So 80-20. So what happened uh, after birth when baby is separated from the mother, is born and it establishes its own respiration. Now you can't work with this HbF, right? You need HbA, right? So it's quickly convert into the other way, right? HbA goes up, HbF goes down, right? So the percentage of presence of this HbF is also a way of determining the age. Like around 3 months of age, HbF concentration is about 7 to 8%. So if you check the blood and you get a HbF percentage about 7 to 8%, that means the baby's age is likely to be around 3 months. Say if it is halfway through 80 and 8, halfway through we'll say around 40 or 50, then you can roughly say maybe 1.5 months. Again, there will be charts available to compare it and determine the survival period of the baby. So this is I'm talking about a baby, whether it is preterm or term, being born alive and surviving a certain period. So changes of the umbilical cord and this blood changes. So if you see a baby with HbF for 7 to 8%, that means the baby has lived for a considerable period of time, around 3 months. So you sometimes you don't have to worry about the signs of live birth to prove live birth. Anyway, uh, after a few days or few weeks, the signs of live birth uh, are not useful. Uh, you use these signs of live birth if the baby is, we found the body or the baby to be dead around its delivery only. Coming back to ossification centers is where is bone is formed. Most of the bones start as cartilage, then from sometimes either end of the bone or the particular person, it's develop ossification, cartilage converting into bone, right? So these are things called ossification center where the bone formation starts. So usually uh, there are certain ossification centers that we use to assess, and according to its developed presence and development, we say this is the probable uh, the age of the baby. I'm talking about intrauterine age because it's important to assess the viability. Now the three bones that usually we use are the sternum, femur or the thigh bone, and the foot. Now, if you take the sternum or the breastbone, which is in the center, right, it has two parts, like wide head called manubrium and then the long part. So it altogether have five ossification centers. From top, one in the manubrium, four in the sternum, upwards going down. So if the ossification center of the manubrium and the first piece or the top part of the sternum is well seen, well grown, we will say it is around 6 months. If it is also seen in second and third piece, age becomes 7 months. The bottom part, fourth piece, it's 8 to 10 months. So this is where the baby is mature, right? So if you see all these things, your assessment will be around 8 to 10 months intrauterine. If you see only these two, it puts the case around 6 months of intrauterine age. Then the lower end of the femur or the lower end of the thigh bone, where close to the knee joint, if it shows a fully well-developed ossification center, uh, it says that the baby is term or close to the full term within the womb. Then the foot. Now we have to see if to see these ossification center, we have to slice the cut through between bone. Now in a newborn, it's very easy to cut the bones. Even with a normal scalpel, you can cut it. Right? What we do is we keep the hold the foot, keep the scalpel between the web foot toe web between fourth and fifth toes, and put a longitudinal cut along the towards the ankle. If you do it properly, it will go through these three bones, the calcaneum or the heel bone where we stand upon, and the talus and cuboid, and it goes through the uh, ossification center. So we call it calcaneum, talus, and cuboid, CTC, where the ossification centers 5, 7, 9. Right. So if you see ossification center in all three will develop, right, that puts the age towards term or fully developed within the uterus. If it is only calcaneum is seen, it's around 5 months. So we can have all examine all these three and have a good assessment about the possible age or intrauterine age of the baby, which will give you a more accurate value than the rest of the observation, like development eyelashes or like you go or whatever. Those are bit subjective. Uh, yeah, I might say this is well developed. Someone else may say it's not that developed, right? So these are a bit subjective, but the assessment of ossification centers make it more accurate. Now, next is how to determine whether the baby is born live or not. This question usually arises if the baby is found dead or killed just after birth, right? So as I tell you, if the baby has lived for 10 days, 3 months, then even the changes of the umbilical cord, changes in the blood cell, blood hemoglobin, or even the physical appearance will tell you whether the baby, right? So if you assess the baby's age to be 10 days, 3 months, then you don't have to worry about establishing live birth because it has already born alive. Otherwise, it won't live up to 10 days or 3 months, right? So establishing of live birth, the fact live birth usually arises if the baby is found dead soon after delivery. So therefore, you can use circumstantial evidence, right? These are not scientific evidence, but when you take the history, someone say that he heard baby crying or seen baby moving or baby mother feeding the child. So these are all circumstantial evidence which are giving you some idea about the alive birth or whether the baby is born alive or not. Then you have the medical evidence, right? There are three. One, proof of respiration by examining lungs, then the presence of food in the alimentary canal, and the changes in the umbilical cord. So I will leave this change in the umbilical cord because I have already dealt with it. Then the presence of food or milk in that case in the alimentary tract means the baby has been fed, right? So it depends on how much of milk where, right? If you find significant amount of milk in the stomach, that means baby has ingested this, baby has swallowed it. So due to swallowing, that baby has to be alive. You can't feed a dead born baby. So if you see significant amount of milk in the stomach, that indicate and that tells you that this has been a live birth, right? Now problem comes if that is also negative, and then you go to examine the lungs, which usually I told you within the uterus it doesn't function, but as soon as the baby is born it start functioning. Baby breathes, so in the uterus or in the womb lungs are collapsed and small, but when the baby is born you take a breath, lungs expanded, oxygen transfer starts. So therefore, there will be you will see certain changes. Um, Now, to move proof of respiration, which is almost equal to proving live birth, we have to examine certain, look for certain signs and symptoms. So, as I told you earlier, if you see pink expanded lungs filling the chest cavity, that indicates baby being live born. because you have taken at least few breaths in and the baby air has gone in, lungs expanded. Pink mean that the circulation, blood has started, that circulation has started. So baby, it indicates the baby to be born alive. Then the thing called flotation test, right? Now flotation test is another test that we used to do, but it does, I mean, it's not 100% accurate test, but usually we do because it can give a good idea about the possibility of live birth. So how do now, if you take the lungs of a an baby within the womb, where I said the lungs are collapse and shrink, there's no air in the lung. So if you take that lung and put it to a bucket of water, it will sink. But if the lungs are well expanded, air has gone in. When if you put the lungs, respired lung, usually it floats. So what we do is we take the both lungs together out and put it in a bucket of water. If it floats, both lungs floats, it indicates live birth. Then what we do, we separate the two lungs, right and left, float them separately. If both lungs separate, both lungs float, it indicates the baby has lived or those are respired lung. Then what we do, we cut each lung into about 20 pieces, float them. If all 40 pieces float, it indicates live birth. But still, there are certain things like resuscitation or trying to revive the baby at birth or putrefaction can cause some of the air going into lung tissues, alveoli, cause the lung to float. So to exclude that possibility, usually we all crush all 40 pieces in a piece of cloth and float them, right? So the condition, if all 40 pieces float, it indicates the baby is born alive or this respired lung. Single piece sinking, then you are not assured about that possibility, right? So this is a somewhat crude test. It's not accurate, right? Still you can get positives and negatives. What you usually do to see whether the amount of air within the lungs. One more accurate way of assessing is doing histology. Right now, this all cells, all the tubes are lined with a mucosa. So if when the baby is in the womb, when there's no passage of air within its respiratory tract, the the, the epithelium or the mucosa has the cuboid or tall columnar cells, right? Tall cells. But when the baby is born and respiration start, it becomes flattened, right? So if you see, do the histology and see flattened cells and well expanded lung alveoli where the oxidation process occurs, that indicates uh, live birth or respired lung. So in all cases of infanticide, almost all cases, it's mandatory that you do histology of the lungs, different sections to prove that it is a respired lung and it is a somewhat more accurate scientific way of determining live birth. Then good old days used to do stomach bowel test where you get the stomach and bowel together, tie at both ends and put it in a bucket of water. They say if it is floating, that means air in the stomach and bowel which has been ingested by the baby. But that is not a very accurate, and usually these days we even don't do it consider because it becomes positive for various other reasons as well. Then the crepitation, like when you touch the lung, you feel air moving under your fingers. Then the fully expanded lungs pressing on the rib cage might have rib markings on the surface. And the next one is the weight, right? So is it that the weight of a respired lung is 1/35 of the body weight of the child, right? So if you have a 2.5 kilo baby, the weight of the lung is around 1/35, 35 divided by 35. Uh, but if you take the baby is unrespired, or baby has not established respiration, it is around 1 in 70, right? Because the weight is less, right? So usually on respiration, the weight of the lung doubles, right? 1/70th to 1/35 of the body weight of the child. So that will also give you an indication about the possibility of respiration being established, right? So this is just a table showing the difference between respired and unrespired lung. Both the lung diameter, this becomes round, this here unrespired flat, circumferences more, and the intercostal space, like the space between two ribs, is increased, right? So these are very relative terms. The color, respired pink and mottle due to this deposition of carbon particles in there. Volume is high. Thoracic cavity is filled with the lung, and the diaphragm, if you take the level of the diaphragm before respiration, it's high up, third rib, and with respiration, it moves down to around being around sixth rib. Then the margins, when it is respired, it becomes round surface, uneven, consistency spongy with crepidus, and the weight 1/35 of the body weight. So these are certain comparison relative criteria that we use to assess the live birth or respired lung. Right. So I don't think I will skip this slide because I have already told you about flotation test, right? And but remember that you can have false positive tests, as I told you, like in putrefaction or artificial respiration. False negative when the atelectasis, the lung tissues are affected, or when there's something like infection and pneumonia sets in. So even respired lung can uh, uh, sink. So therefore, that also indicate that doing histology is this sort of thing. It is essential to differentiate between the two. See whether it is actually air or whether it is putrefaction, whether it is just absence of air or whether it is due to something called atelectasis or pneumonia consolidation. Okay, this also now I have already done, so I will skip this child at well. And this also I have told you that called the Bristol test that takes stomach and intestine clamped and tight, putting it in water. Now we're going to legal aspects, right? I'm not going to talk about the law because you know more than me, but how to cater for the existing law. Now, as you know that this is a culpable homicide not amounting to murder coming under exception 5 of the section 294. If you consider the England and Wales, they have a special infanticide act which is enacted in 1938, and their charge is manslaughter. So society legal situation is also little bit different. And now coming to that question that was asked earlier, how to determine whether the mother's mentality or the mental status is affected, that you have to. So if you get a case, right, a dead baby, and mother, the suspected mother is also available, right? If the mother is not available, we can't know. But if you get the mother, you have to refer the mother to a psychiatrist and get her mental status evaluated. The psychiatrist will tell you whether there has been affected, the psychological status is affected, or whether it is due to effect of pregnancy, childbirth, or lactation, right? So it's very important, because if the mother is not affected, not mentally normal, then according to the classification or definition, you cannot classify it as an infanticide, right? But what happens is, usually when this happens, almost always they are affected, or the even psychiatrists find it difficult to say whether there is a even slight degree of affection or not, right? Because usually almost all mothers, soon after giving birth to a child, they are mentally affected. So that's a known fact, right? So it's almost all there, but for a legal purpose, we have to refer the mother and get the psychiatrist opinion, which usually comes, almost always comes as a positive, right? Anyway, now,
Then only the psychiatrist report only we need to prove the case, is it?
sorry,
So then only we need the psychiatrist report only we need to produce to the court or to prove
no. So that this is just
that
to
the
say
mother's
that,
side actually. Mother's
yeah,
side.
mother's side, you have to get the psychiatrist report, because if
So,
yeah,
what if we found a bones of a baby less than
yeah.
28 weeks? In that case, how do
Now,
we do the
now in
plan?
that case, right? Okay, that will be a different. Now, then if you find only bones, right? Then you find it difficult to trace the mother first, right? So if, now, then before doing anything, you have to establish that. Say you have a suspected woman, right? Establish whether it's the mother or not, right? So if you prove it, again, you say them, say you have find the bone, right? Then they have more difficulties. If you find only the bones, then you might not be able to determine how it has died, right? It may be trauma, it may be spontaneous, right? It may be a case where there's a concealment of baby dies and they bury it without any informing anyone, right? So there are few difficulties which rise. If you find only bones, then probably sometimes finding the cause of death is also difficult, right? But anyway, say if you find, and then if you have a suspected mother, then before doing anything, that you have to establish and confirm that it is the mother, right? So if it is the mother, if you are thinking about the possibility of infanticide, or you are say we are going to prosecute, to have some evidence that the baby has been killed, then again you have to go for psychiatric assessment of the suspected mother, right? Because if now according to the definition, it has to be infant, right? It has to be the biological mother, right? So before doing anything, you have to establish the age of the baby, right? So if it is to establish, if you say it's more than 1 year, then you are not, I mean, no point
going for
considering whether
infanticide?
biological mother or
Yeah.
she is affected. But when you say baby's age is less than 1 year, right? Say it's been killed, then if you have suspected mother, then you have to establish the biological connection. So if the second step, if you prove that it is not the biological mother, then you don't have to go for this psychiat, because it's doesn't fall into it, the definition of infanticide, right? So if it is an infant, and if the suspected person is the biological mother, then you have to go for a psychiatric assessment, psychological assessment of the mother, right?
Okay, sir.
So
Thank you, sir.
what
Understood.
usually happen is, when you, I mean, it there's some affection, it affects almost all mothers. So psychiatrists also, they don't take a chance, because now if you consider, now we are not dealing with a serial killer or murder, right? So it is an infanticide by the mother, which is attributed to her psychological states, right? So almost always when we send for psychiatric assessment, in the case of suspected infanticide, we get a positive report, right? In case you get a negative report saying that mother is perfectly normal, then it doesn't fit into infanticide, right? Okay.
Yes, sir. Thank you, sir. Understood, sir. Clearly. Thank you,
So
sir.
now we come to whether now sometimes when you look at the baby itself, we say whether infanticide could be excluded, like macerated fetus, where intrauterine death occurs, say maybe few weeks prior to the delivery, then within the womb there is some changes going on, right? Like become whitish and rancid smell, and the skull bones moves over each other, right? And you when you see those signs, when you confirm it is a macerated fetus, it tells you that it is an intrauterine death, therefore infanticide is excluded, right? So that is one where we exclude infanticide. Then, as I told you, congenital malformation incompatible with life. So there are certain serious congenital abnormalities where it is not compatible with life, right? The point is sometimes at the time of birth they are alive but die soon after, right? So something like that. Even anencephaly is its sense that the most of the part of the head, a brain is absent. Then cases of esophageal atresia, or it's not developed, or serious heart abnormalities which are not compatible with life. They might be born alive but dies almost immediately, right? So maybe a live birth, but this presence of this serious cardiac or serious congenital abnormality, they are not compatible with life. So even if you have some suspicion that mother has done something to kill the baby, still we don't consider, because something like anencephaly, esophageal atresia, cardiac causes may be the actual cause of death. So you cannot prove it beyond possible doubt, right? So therefore, if the presence of serious congenital malformation, we tend to say that it is the malformation that has killed the child, not the mother. Then the extreme cases, extreme immaturity. Like now I told you, for us, it is 28 weeks. Anything below 28 weeks, we consider to be premature or immature. Right? So again, if it is less than 28 weeks, uh, case becomes difficult to prove. So it is usually attributed, the death is attributed to immaturity rather than some outside cause, unless you have a obvious, you can prove that the baby was born alive and mother has done particularly something like say cut injury of the neck, something to kill the baby, right? So extremely now, if say maturity is around 16 weeks, right? We don't even think about possibility of infanticide attributed to the maturity. Then the intrapartum or the deaths occurring during labor, like the baby getting aspirated, meconium or something, aspirated goes into the respiratory tract, it causes death. Then the cord around the neck, and delayed labor, where the baby being during the process of birth for a few hours, which might cause hypoxic changes and cause certain things and baby dying. So if that is the incident that we tend to say that it is, we say the death is attributed to aspiration or whatever that problem, and leave infanticide out. Now, considering about the methods used to kill the baby, anything like from manual strangulation, smothering, ligature, blunt weapon trauma blows, or sharp weapon trauma cuts and stab to the neck, stab. Even drowning, keeping the baby's nose and mouth under liquid or water, even poisoning, mark the possible things, right? So you have to look for all these things when once we confirm it to be a live birth and when we suspect infanticide. Then the acts of omission where you don't do something that should have been done, like unattended labor. You don't tie the cord or labor goes unattended. Your baby is just born, it's not attended, and to some various reason it dies. Or the failure to tie the cord, non-feeding, and also exposure to cold heat without proper clothing, where mother does not do something that should have been done. Right? So these are the act of commissions and omission. Right? So all we have to show that this act of commission or omission is the one led to the next complication and resulting in death ultimately. So therefore, medical legal aspect of questions that we have to answer, uh, these are the main thing: whether was the child stillborn or born live. If born alive, how long it did it survive, and what is the cause of death? So if you are able to answer at least for these three in a methodical manner, then you can either prove or confirm or exclude infanticide. Right. That is the end of the infanticide lecture. Anything you want to clarify about uh, this before I'm going to next one? Any uh, areas are confusing or where you cannot understand what it means or how to do it? Right. Now it's 8:30. So it's in the absence of it, before going to next topic, shall we take a 5 minutes break?
Yes, sir. That'll be
Okay,
fine.
so now it's 8:30. We'll be back by 8:35, right?
Okay, sir.
Shall we start the next one?
Yes, sir.
Hi, Arlene.
Yes, sir, we can, sir.
Right. Okay. So the next one is childhood, but now what I do is I'll tell you about the condition called sudden infant death syndrome. Because now when you get the infant, I had done infanticide and SIDS or sudden infant death syndrome. Apart from that, all child deaths also falls into the deaths categorized or deaths occurs in adults as well. Like they can be accidental, mostly accidental, homicidal, natural. So there's no difference between the adult death and child death when it consider the circumstances like the homicide is similar to any other homicide. If it is accidental, probably it is similar to any other accident, but only thing is the types of accidents will slightly vary from the adults. When it comes to natural, maybe something like natural disease like infection, pneumonia, those things settings. Definitely, you know that the possibility of myocardial infarction, atherosclerosis, those are rare. Then not rare, almost not seen. But then the another group is falling or occurring due to the defects. Now, earlier I told you about congenital abnormalities which are incompatible with life. But there are another group of uh, congenital abnormalities you can live with, but later, maybe months after, gives rise to problem and complications and patients die. Particularly heart problem, the these are popularly known as hole in the heart or ventricular septal defect, right? If not treated with not diagnosed, it can give rise to, right? So when you take childless, it's almost portion is almost similar to deaths in adult, homicide, accident, and natural. So, but the natural diseases are, should take statistics, are a different group of natural disease rather than what you find in adults like atherosclerosis, hypertension, those things, right? So I don't say that the hypertension, those things cannot occur in child, but certain due to certain malformation or abnormalities, they can have um, hypertension even from childhood, right? Depending on now, there are thing called even diabetes, right? Inherited type, right? We have a type 1 and 2. The type 1 is you can see in juveniles or children, right? So you can't, but it doesn't occur, but definitely the incidence of having a child dying of diabetes or hypertension is very far less than it is seen in adult. But natural disease process pathologies resulting from complications resulting from congenital abnormalities is much more than it is seen in adult. Adult usually it's almost not seen. There are certain abnormalities which can go run into the adulthood, but so therefore I don't think that I have to deal with those things separately, right? Because part of it which is important in either confirming or excluding infanticide, confirming or excluding sudden infant death syndromes you deal with, right? So the next presentation, I will tell you something about the SIDS or sudden infant death syndrome. Now this presentation, I think I got it email and with a very detailed presentation, but I will not go into all the details. I will tackle the main points. So you have the opportunity to read and understand. So if there's any questions, we can clarify later. So let me share the presentation. Right. So sudden infant death syndrome. Can see the slides, no?
Yes, sir, we can see the slide.
So I'm talking to you about sudden infant death syndrome, or popularly known as SIDS, SIDS. Now, sudden infant death syndrome, or SIDS, it's continued to be the most common cause of post-neonatal infant death, right? So the post-neonatal period is usually 28 days, right? So this is seen after uh, 28 days, or roughly 1 month. So 25%, roughly 25% of all deaths between 1 month and 1 year of age is attributed to SIDS in other countries, not in Sri Lanka. Well, I will tell you why later, right? Now, SIDS is a complex multifactorial disorder of which causes yet not fully understood, right? Still, no one knows how exactly how SIDS occurs or what it is, right? These are all based on theoretic theory and practical experience and practical difficulties, that they have classified a certain types of death into SIDS, or sudden infant death syndrome. Uh, Now, researchers say there are some environmental risk factors as well, which could be modified, and some researchers say that modification of these external factors have reduced the incidence of SIDS. So therefore, it may be one mechanism, because SIDS definitely can have, as I said, multifactorial, so you can have many mechanisms, more than one mechanism occurring and causing in death, right? So like reducing exposure to modifiable risk factors have lowered the incidence of SIDS. So they think there's a association of between that factor and child death as well. Now, new research indicates that even there could be a genetic risk factor, genetically determined risk factor, which sometimes normal clinical examination, normal investigation cannot diagnose or cannot confirm. So even now they are going into genetic studies, right? So they said maybe it's a genetical thing which affects the probably heart or respiration that caused the baby to die, right? So actually speaking, still no one exactly doesn't know what the exact cause or exact mechanism of this thing called SIDS. So when you talk about a definition, it is a sudden death of an infant under 1 year old, right? So actually I don't have to say infant under 1 year. When you say infant, it is 1 year, right? So sudden death of an infant that is unexpected by the history or unexplained after a thorough post-mortem examination. So where you find the infant dying, right? Where the history or the details does not give any clue about the possibility of something causing death, or a thorough post-mortem examination, which examination with investigation does fail to uh, we here to find a cause, right? Uh, so in this investigation, may include like complete autopsy, investigation of the scene of the death whenever possible, and review of the medical history, right? So it can maybe review of the medical history if available, and also other investigations. Like in other countries, they use a array of investigation, including enzyme and hormonal studies. Where in Sri Lanka, we find it extremely difficult to do it because the facilities are not available. It is costly, and it is not available everywhere in the country, right? So we are lacking it there.
Sir,
Checking, yes,
so then in the death certificate, the cause of death won't be mentioned?
yeah, I'll come to that because,
Oh.
right, now what I want to put is, now this is sudden infant death syndrome is a very popular term or used in forensic medicine or medical right? And other countries, they give the cause of death as sudden infant death syndrome because they are able to. Now, detailed autopsy we also can do, right? Investigation of the scene we can also can do. Review of the medical history we can do, right? What we are lacking here in Sri Lanka is the investigation part, which involves assessment of enzyme and hormone, and sometimes even genetics, right? Because what usually you classify a death as sudden infant death syndromes when you review the case, take the history, and doesn't indicate anything. You do the autopsy, doesn't indicate, you don't find anything which can cause to death, right? And you do a full array of investigations where you can't find a cause, right? So like it's a diagnosis by exclusion, right? You exclude everything else, and when you find it, you cannot explain or cannot find a cause for the death, you classify it as a sudden infant death syndrome, right? Only thing difference is other countries also do the same thing, but we also do. But only thing is we can't. We find it difficult to do these enzyme studies and hormone studies and each and every case, right? So therefore, we don't know in our setup whether the death is due to hormonal or enzymal deficiency or something. So, in my opinion, in our setup, it's very, very difficult for us to classify death as sudden infant death syndrome. We can definitely say that the cause of death is not established. It is not traumatic. It is not something. It is the cause of death, not accidental or traumatic, but cause of death is not cannot be determined, right? Because to say SIDS or classify it under SIDS sudden as sudden infant death syndrome, we have to exclude all the possibilities, including genetics, hormone, and enzyme. So if we are lacking there, we certain instances we cannot do the whole array of investigations. So therefore, in my opinion, in Sri Lanka, we cannot classify a death as a SIDS, but what we have to say is it's a cause of death is unascertainable, but it is not traumatic, right? Now we come to the definition, right? Sudden infant death syndrome, also in later called crib death or cot death, is a sudden death of an infant which remains unexplained after a complete postmortem investigation, including an autopsy, examination of death scenes, and review of the case history. As I told you, right? So postmortem examination includes everything: dissection, usual maybe histology, other studies, and also genetics, hormonal enzyme studies. Now, SIDS, there are a lot of myths about SIDS. So you have to have some idea about what it is, what it is not. So about what it is a major cause of death in infant after the first month of life. Usually it's after the first month, right? So it's a, as I told you, SIDS. If you diagnose it properly or exclude other possibilities, you can give the cause of death as sudden infant death syndrome, right? So it is a major cause of death of infants after first month. It is sudden and silent. Like apparently healthy infant might die suddenly, right? Without any apparent cause or mechanism. And it is also unpredictable and unpreventable. Though now we have some researchers said these are the possible risk factors. If you modify it, it is lower. Still, there's no 100%, they are not established 100% connection. It's a like a possibility, right? So you have a you alter that risk factor, it alters the reduce the incident, but still you don't know whether it is due to the direct relationship or due to something else, right? So anyway, it is still unpredictable and unpreventable, and it's a quick death with apparently no signs of suffering and usually occurring during sleep. So sometimes researchers they say it may be due to some sleep disturbance or some disorder, or even maybe the position of sleeping, because in some studies they have seen that the baby's sleeping in prone position, face down, the incidence of SIDS to be higher than the rest. Right? So maybe they think that may be due to even the sleeping position. Some now say it is not maybe that, but also there may be some sleep pattern disorder due to even a genetic thing, right? So they get apneic in the sense stop breathing uh, suddenly due to some genetic or hormonal defect, right? So, but these are all theories and still under research, right? So maybe in few years they might find the exact cause, but still, well, the exact cause is not known, and there are various theories, so you don't know exactly what it is due to and what it is not. And that is, this is also important because when you find a baby dead, right? When your investigation, sometimes you you don't know about this, seeing that you might think it may be SIDS or may not be SIDS or it may be infanticide or something else. So, but it is not. It is not caused by vomiting or choking, right? So, if it is caused due to in aspiration of vomiting or something getting blocking the respiratory tract, it is cause of death is aspiration or choking. You can't classify it as SIDS. So now you might see the you might find a dead baby with evidence of vomiters being aspirated or choking, right? So then it's not a case of in SIDS, it's a case of aspiration or choking. Then it doesn't cause by external suffocation or overlaying, right? The problem here is now suffocation is where the oxygen intake of uh, transport is not happening, like air is not going into the nostrils or mouth. It may be due to the, like in a small baby, maybe due to the sleeping position or soft cloth covering the nose and mouth, right? So it is due to that. It is not SIDS, but only difficulty is if it is something like that, a soft part piece of cloth covering the nose and mouth, preventing air going in and causing the death. Say that once the cloth is removed, you will not see any evidence of that unless you find the baby on that position. So therefore, it, it puts you at a difficulty because it may actually due to the suffocation, but you don't see. And mistakenly or without, since you don't have any other explanation, some of the death at the end may be classified as even SIDS. Now, it is not contagious or hereditary, right? So, contagious doesn't, I mean, transmit from one baby to other, whatever the cause, or it is not earlier there's hereditary, but now if it is, they find it to be a genetic problem, uh, still they have not found that whether it is transmitted from like mother to child and that thing, but if it is a genetic basis later. One day they might find a hereditary component as well, but at the moment it is not. It may be like a single genetic abnormality mutation occurring in that particular baby. At the moment it is not sure. Then it is not type of child abuse, death due to child abuse, right? Because if the death is due to child abuse, it's whatever thing following child abuse, right? So what and it doesn't related to any cause of, I mean, nurturing, lack of like or immunization or even allergies, right? Because that definitely if the baby dies of some allergy, it is the allergy, right? So what you have to remember is sudden infant death syndrome or SIDS. We classified it as due to SIDS when all the history investigation, including autopsy, other investigations, plus genetics and hormonal studies, and also the medical review of the medical history does not reveal or that we don't find anything that we can attribute to death, right? So
So then,
actually,
sir,
when,
in
yeah,
another word, we cannot find the cause of death.
yeah. So we cannot find the cause of death, right? Now,
Uh,
there are instances that we cannot find the cause of death due to certain things, like say body is putrefied, right? You might not be able to find the exact cause
mm,
of death. But
mm.
say we find a small baby, 2 months old, found dead, but the body is putrefied, right? So then now, due to the putrefaction, you can't do certain investigations. And even if you do that, there's no use, right? So, but that death cannot be classified as a SIDS because the putrefaction has resulted in that you cannot determine certain things, right? Or else, uh, yeah, the cause of death may we cannot find the cause of death maybe due to certain other difficulties. Either investigations not available, or I mean you cannot histologically see that thing, right? So point is, if someone is categorizing a death as sudden infant death syndrome, the he or should be able to say that there's nothing suggestive in the history, and that we have done the full complete comprehensive autopsy, right? Which any of like even putrefaction or something not affecting your investigation, you do a comprehensive thing, you still can't find anything. You do the routine investigation, you can't find anything. Then even you do hormone and genetic studies, you can't find anything. Then you have done a full array, you have excluded the accidental and other traumatic thing you can't find, and then you classified it as a SIDS. So actually talking, SIDS is a cause of death that is given when you can't find anything, but you have excluded almost all natural things and unnatural things, right? So one day, right, maybe in, right, say 10-15 years time of now from now, researchers might say, no, this is the cause for this apparent SIDS, right? So then probably if that happens, then we have to drop the terminology of called SIDS, and whatever the pathology or the cause should be written as a cause of death. But up to now, what has happened is you still the researchers don't know why this occurred. Only thing is they have the ability to exclude so many things, the normal things that we know. The pathology is seen by naked eye or histology, routine investigation, different type, or sometimes even hormonal enzyme and genetic studies, right? Now, general characteristics of SIDS is what they observe is usually occurs in colder months. So that is another reason that probably we are not seeing it much here. It may be due to now the colder months we are talking, what they are talking about real winter, not like here, right? But it's they don't come up with a certain level limit of temperature, but so it might even here might show certain I mean common, maybe common during the colder, relatively colder months. Then the what they have seen observe is mother, when the mother is younger, less than 20 years old, they have observed that the occurrence of fits or sudden infant death seem to be um, more. And the babies of mothers who smoke during pregnancy uh, or exposed to secondhand smoke, they have observed that it is the incident is to be high, and there be more common in male, 60 to 60%. It is occurring in the male. Out of the six deaths, 60% are male, 40% are female, right? So that means the males are more prone to die of fits than female, and also it is commonly seen in premature or low birth weight, right? And also there's upper respiratory tract infection presenting in about 60% during the prior weeks, and also it occurs quickly and quietly during a period of presumed sleep. So these are the general characteristics. So probably in the future, now they are doing research in all involving all these areas. One might find, one might confirm or exclude one of these factors in the future. But at the moment, these are the general characteristics patterns seen in cases of sleep. Now, risk factors, what they think as risk factors, they are parental. As I told you, the age of the mother, maternal smoking, drug abuse are shown to more commonly associated with SIDS than the others. Like even short intergestational interval, like the closely born children. Later, no prenatal care, low socio-economic group, and even sometimes like ethnicity, African Americans and American Indians are they have think that they are the more prone, right? So there may
So
be
what about new viruses like COVID and maybe in future coming viruses?
so like yeah, if you find a viral infection, evidence of viral infection, and you confirm it, right? So that is that infection
That is
killing
not
the
comes
baby.
under SID. Yes, yes.
It doesn't
Okay.
come under SIDS,
That's it.
right?
Yes, sir.
Right. So essentially, at the moment, SIDS is a diagnosis by exclusion. Actually, simply speaking, where you can't find the exact cause of death. But you have to be pretty sure. You have to exclude all possible causes, right? So without excluding all possible causes, you cannot come to a diagnosis of SID. So that is what has happened in our setup. We cannot exclude all the things. Maybe in America, England, they are able to exclude all possible at the moment what they consider the possible things, or including hormone, right? So now in our setup, we can't do hormonal studies. So actually, practically, we cannot classify any death as SIDS. We have to say cause of death is unascertainable, but it is say it's say not it is not unnatural and not this, so therefore cause, right? So I, in my opinion, in Sri Lanka, we can at the moment we cannot classify a death as SIDS because we are lacking in the investigation part. Now, infant, now they think like there may infant factor within the baby. Like now they think there may be some abnormality, brain stem abnormalities. The brain stem means the area that control all vital functions, including the heart and breathing, right? So they think there may be some small abnormality which associated with defective arousal. Babies doesn't wake up from the sleep, or even something to do with cardiorespiratory control. So that is the area now they are concentrating upon actually, right? Which may be a genetic disorder or a physical disorder, but now they think it is very likely to be something due to the brainstem function, brainstem abnormality, causing affecting the vital function, including respiration and cardiac, causing the death. And also the as I told you, premature babies, male sex, and twins, multiple birth, and SIDS in a prior sibling, and even antecedent respiratory infection looks that it is common, baby is common or more prone to get die of SIDS. Then the environmental factors like prone sleep position and sleeping on soft surface, it's very likely that the a part of the sleeping surface or a cloth blocking the nose and mouth, and even hyperthermia and postnatal passive smoking, which might have some link or connection to SIDS, right? So I will not go into details of this. You can read it later. These are the probable list of risk factors. Most I have already mentioned, and social factors, right? Again, I have mentioned. Then the parent related factors or the mother of SIDS infants like less prenatal care, low birth weight, IUGR, right? So these are some related factors that they think that makes a baby prone to dying of SIDS. Other concerns like upper respiratory tract infection has not been found to be independent risk factor for SIDS, but they have found it to be commonly associated. And one thing that parents should be assured that the immunization does not present a risk for SIDS, because if that happens, they will probably die of other infections rather than SIDS. So right, so we have to assure that there's no relationship between immunization and babies dying of SIDS. And also, not, as I told you, not for caused by vomiting or choking. Right. So this is what I have said about the genetics. You don't have to know, remember these things, but you read it, then you get some idea about what they mean. Right. So they have at the moment do not find any difference between like a genotype, the infant dies of SIDS, but they have found some difference, gene polymorphism, like difference between genes in several cases. And also now they are trying with this triple risk model, suggests gene polymorphism may make the certain infants for more vulnerable to SIDS. Um, and like pathogenesis or how what happened, as I told you, actually no one knows what actually happened, but there are theories, right? So generally it is accepted to be multifactorial, like more than one factor playing part. And they have this triple risk model where I say you have a vulnerable infant, right? And also critical development period in homeostatic control, right? So when the baby is born, and let's say around 1 month, the baby is still adapting to the external environment, still adapting, and their the systems, the defense systems, is still developing. So that makes them to be more vulnerable for certain things rather than the elder children or the adults. And also something like exogenous stressors, including environment factors, smoking, and even sleeping surface. And the other thing they are concentrating on, as I told you, is with the brainstem abnormalities, which cause defective cardiorespiratory control. Right. So some medical findings that consistent with SIDS, right? External appearance, right? If you examine, sorry, their normal state of hydration and nutrition, you can't see any defect there. And you might usually see small amount of fluid in the mouth and nose. Sometimes vomitus even present because it may be a terminal event. And normal, the post-mortem lividity and Vigo or everything that we usually set in. But internal appearance on autopsy, most cases they show a pulmonary congestion and edema, which is not pathognomonic, may not due to SIDS, the general uh, post-mortem change. Then sometimes you say intrathoracic fatigue, small bleeding in 90% of the cases. So these are the things that they have commonly found, but no one knows whether it's particularly connected to SIDS or not. Like evidence of vomitus and microscopic inflammation in trachea. So it may be due to the inhalation of fluid or something, or it may be characteristic thing seen in SIDS, but point is at the moment, no one surely knows. So autopsy findings, there's no pathognomonic finding. Right? There's nothing like that. When you see it, you classify it as SIDS, right? So it is, as I told you, still it's a diagnosis by exclusion, right? But these are again the common findings that you see in a the possible case of uh, seeds like petechial hemorrhage, congestion, and secretion. Uh, in like about two-thirds of cases, you might see low-grade asphyxia, where some oxygen deficiency to the body. So now they are doing this study in cerebrospinal fluid, the CSF fluid abnormalities, and also about the hypoxia, because some people think that it may be frequently precede the death, or maybe whatever the cause leading to hypoxia may be the actual cause leading to it as well. So only problem is, however much I tell you, just remember that still this condition is still under investigation. No one has found the exact mechanism or mechanisms of death resulting in SID, right? So one study of 26 infant has found one of the hormonal level being affected, and some study has found that presence of bacteria, right? So they are still thinking about whether they are really connected or not. So this is the typical scenario, right? Almost always occurs during sleep or apparent sleep, and usually the child is healthy prior to death. You don't expect anything because the child is normal and may have a cold or recent physical stress, and many have been placed down for nap, found not breathing or appearing dead, right? So that's why they think it is related to something. It's really controlling sleeps or even the sleeping posture. uh, and parents have not hearing any signs of struggles or any many abnormality in the child just prior to death. And something about the epidemiology, that's a leading cause of death in USA, right? Because they are able to exclude almost all other natural and unnatural things but through investigation. And 90% of these hits occur when the baby is less than, in babies less than 6 months of age, right? Mostly between second and fourth month, right? Uh, then I think I have already gone through this, the maternal factors and environment factors, so I don't want to go into detail again, right? So why, how do you avoid, sleeping, get putting the baby on sleeping on soft surface, no pillows, spirit, right? Sleeping clothing, right? Then avoid hyperthermia, right? Putting no excessive blankets, set thermostat for appropriate temperature if you can have that facility to control the temperature of the room or the sleeping area, and also avoids something like heaters, because some people may think that it is they think that it is case of hyperthermia rather than so essentially what I want to tell you is sudden infant death syndrome or SIDS is where it is a diagnosis of exclusion, right? You take the history, there's nothing suggesting of a possible death. You do the autopsy, you don't see any macroscopical naked eye findings. You do the histology and other studies, there's nothing. Then you do the all ancillary investigation, again negative. And then you do hormonal enzyme studies and even sometimes genetic, it, you don't find a cause. Then, because you have excluded all these possibilities, if so, then you classify it as, and it is not unnatural death, then you classify it as a SIDS or sudden infant death syndrome. What happened in Sri Lanka, in my opinion, why we cannot consider diagnose SIDS here is not that it is not present, because it's just because we don't have enough facilities to do certain investigations, particularly hormonal and enzyme studies. Right? If we have that facility, we also could classify it as SIDS, but still it is a diagnosis of by exclusion, and where that we don't know the exact cause and mechanism of death. We just have a bunch of theories, possibilities, think about the risk factors, and but it is still under research. Maybe in 5 years, 10 years time, uh, they might say that this is the cause and mechanism of death in this classified so-called classified SIDS, but still it's under research. So what we dare to do is a complete autopsy, and whenever possible, do the examination of the death scene, review the clinical history, and also exclude the differential diagnosis, something like child abuse, intentional suffocation, exclude everything, and do all the investigation. If negative, to diagnose it as SIDS. Just to reiterate, in my opinion, still in Sri Lanka, we cannot classify a death as SIDS unless we say the cause of death is unascertainable, right? But the important thing is, especially that you exclude unnatural or traumatic events where it is prone to, or more likely that some legal issues crop up, right? But if as long as it is natural and you have excluded the unnatural, accidental, intentional injuries causing the death, then writing it as cause of death is unascertainable or undetermined is okay, maybe as same as SIDS, but we are avoiding the term SIDS here because we don't have facilities to do very specific uh, tests like hormonal studies. Anything you want to question on? Right, this question now, certain slides have much detail, so I didn't go into details. So what I want to give you is just the outline, the importance of knowing this term and what is happening, right? So you can read it, and whatever the content here is more than enough, right? So you won't get a full question on sit. Maybe if even if you get it, maybe just as a part of a question which carries less mark, so you don't have to worry about it. But there's nothing very serious about it. The only thing is to know is the general thoughts about SIDS and why we write it, and also just remember that it's a diagnosis by exclusion. Anything else you want to clarify? If not, I can terminate the session because you have another lecture at 10:30, no?
Yes, sir. 10:30 we have another one.
We can have a 1 hour break. Okay, so if okay, I'll terminate the session. So if you have any questions, anything to clarify, you mail it to Udeshika, right? Then he will forward it to me. Then probably I might be able to uh, clarify those points and get to Udeshika to mail it to all of you, right?
Okay, sir. Thank you, sir. Thank you, sir.
Okay, thank you very much for joining. I'll
Thank you, sir.